Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. We're going to be speaking with returning guest, rheumatologist Dr. Hillary Norton. She's living with ankylosing spondylitis. It's a form of axial spondyloarthritis. She's joining us to talk about ankSpA, the signs and symptoms, and share her own experience with this condition. And she's joined this morning by Jill. She's a patient living with non-radiographic axial spondyloarthritis, or nr-axSpA. She's going to talk about her experience with this condition as well. Welcome to Health Professional Radio, both Dr. Norton and Jill. Thank you both for joining us this morning.
Thank you for having us, Neil.
Thank you, Neil.
Dr. Norton, if you would give us a bit of your background for those who may not be familiar with you as a contributor.
Sure. I developed symptoms of AS, which is a form of ankSpA, when I was in my 20s. This was before I went to medical school, and ankSpA is a form of chronic inflammatory back pain. So I had a typical onset. This is generally a gradual onset when people are younger. I started developing pain at night, and I had trouble even turning in bed. Once I did turn, which would take quite a while, I was able to sleep for maybe an hour or two, and then the process would happen again. And I always thought it was something I did in my workout because I was really active. So I ignored it for a while. And when the night pain got bad enough to be scary, by this point I was in medical school, and I was up like other patients in the middle of the night looking online and trying to find an answer for my symptoms. But every time I got to the part about a chronic medical condition, I would skip the whole section because I thought, well, I have a back problem. I don't have a chronic disease. Mm-hmm. And this is why I'm so passionate about raising awareness for ankSpA, because there are so many undiagnosed patients out there. That's why when Novartis approached me about collaborating on this Monster Pain in the AS campaign, I was so excited to help get the word out and help patients recognize that this back pain could be chronic inflammatory back pain.
Jill, were you experiencing similar symptoms, and did you kind of ignore it as well?
Yeah, like many of us, and like Dr. Norton, I had symptoms on and off really from teenage years. They got progressively worse to the point of severe, which is what led me to the rheumatologist eventually. I think many of us ignore them or just think they're typical back pain. But it catches up with you, for sure. So I was diagnosed in 2013 after decades probably of having intermittent and more progressively worse back pain.
Doctor, is this a condition that affects women primarily? Is it distributed equally throughout men and women?
You know, we used to be taught that this was a disease of men, but we now know that it affects both men and women equally. Women are more likely to have nr-axSpA, which is the non-radiographic version that does not show up with X-ray damage, and men are more likely to have AS, which shows up on X-ray, but women can have AS as well. And this is part of the reason that so many people have been underdiagnosed and not recognized, because typically women were not really looked at as having this disease.
Jill, after your diagnosis, and I'm sure looking into the disease a lot more, did you find that you were the only one in your family, or is this something that can be attributed to family history?
That's a great question. So I was the only one at the time who was diagnosed. I, of course, have learned quite a bit about ankSpA since then. Since I was diagnosed, there are a couple more distant family members, but there's also family history of some other similar diseases in terms of inflammation. And I have two daughters now. I watch them closely to see if they're going to develop it, because that's a concern, certainly.
Hillary, as a physician living with this condition, speak a bit to the treatment options, both over a long period of time, and are there ever any instances where an emergency treatment is needed?
Yeah, that's a good question, Neil. We have really good options for managing this disease. So that's where working with your rheumatologist really comes into it, because there is just no one-size-fits-all treatment plan. So your rheumatologist is going to work with you on a number of different things. And I talk to my patients about general lifestyle things like staying active, maintaining a normal body weight, not smoking. We know that smoking makes ankSpA worse. eating a healthy diet. And there's not any one specific diet for AS that looks different for everybody. And then we have medication options as well. And so that's where everything is going to be covered by your rheumatologist, and I come up with an individualized treatment plan for every patient.
Well, let's talk a bit about monster pain in the AS. Talked about being approached earlier in our conversation.
Yes. So this campaign, monsterpainintheas.com, is a simple 3-minute quiz that people can take if you think you might have inflammatory back pain. And if it turns out that you do, the quiz can actually direct you to a rheumatologist, which is an important next step. There's even an option to have a telemedicine consult through the quiz. So this is a great way to just identify whether your back pain may actually be inflammatory.
Jill, have you taken advantage or told others how to take advantage of monsterpainintheas.com?
Absolutely. Even many years out on diagnosis, I still refer to it for some good information in terms of living with the disease and what to do after the diagnosis. But it's great. It's a series of short questions that helps you to understand if your back pain is inflammatory and if it might require seeing a rheumatologist. I'd highly recommend it.
I'd like to hear your advice to others who may be living with unexplained back pain, based on your diagnosis, your experience up to the diagnosis and after.
So I think a lot of it is, like Dr. Norton said, pre-diagnosis, it's really becoming a warrior and trying to figure out and empower yourself about what's going on with your body. The day goes by quickly, so you embrace what you can do today to change tomorrow. I think that's huge. And really after a treatment or once you begin feeling better, to really take control of your body and treat it systematically. And, food, exercise, all those things are really important for any of us, but more specifically, I think for people with AS, keep moving. That's that's huge.
And doctor, talk a little bit about maybe the questions that a patient might ask a physician in order to get diagnosed a little bit faster.
Yes, definitely. So there are certain things that you can present at the time of diagnosis that will really help. Some things that I ask my patients are what makes the pain worse and what makes it better. Is there a time of day when your pain is worse? Does exercise help? How long have you had back pain? Is there a family history of this? And is there a family history of related inflammatory syndromes, such as psoriasis, inflammatory bowel disease? Those things can have a shared genetic predisposition. So preparing all of those questions can certainly help get you to a rheumatologist and to help avoid misdiagnosis like both Jill and I have been through.
Now, once again, would you give us that website where we can learn more about AS and the associated conditions and about the resources for treatment and diagnosis?
It's monsterpainintheas.com, and you can go take the simple 3-minute quiz and get referred to some great resources from there.
Dr. Norton, Jill, I appreciate you both joining us here on the program this morning. Thank you.
Thank you for having us, Neil.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.